Thank you very much for the introduction. We'd like to thank the organizing committee for giving us the opportunity to share this work. This is actually a study which was set up, funded, and organized by Allergan, and I'm presenting on behalf of our group. So essentially what this study is about, that we know that botulinum toxin does help, but we want to look whether it is working as effectively under real-life circumstances as it does in the randomized trials. So here are my disclosures. So I would make it clear that it is funded by Allergan, but my trip here is not funded by them. So we know from a number of randomized controlled trials that Onabotulinumtoxin 100 units has demonstrated significant improvement for the control of urinary incontinence and OAB symptoms in patients who have failed anticholinergic medications. But interestingly, there are very few studies looking at the real-life situations that out in the hospitals up and down the countries, how effective it works. So we set up doing a prospective study examining the efficacy of Onabotulinumtoxin A to look at the efficacy and the quality of life improvement in this group. So this was a multi-center prospective, but was an observational, non-interventional study enrolling patients who were greater than 18 years of age in 4 Western European countries. All these patients have failed treatment with antimuscarinics, and they were willing to initiate self-catheterization if need be. The core primary endpoints were mean and percentage increase in the urinary incontinence and improvement in quality of life in the treatment benefit scale. And there were a bunch of secondary endpoints, including improvement in urgency, but looking at the proportion of 50 to 100% improvement. Also looking at the use of incontinence products in the community, whether it is decreased, because obviously that has an implication, cost implication. And evaluating that as far as the patient is concerned, do they think that actually the frequency decreases? And this was evaluated 3 days before the injection and at 12 weeks. And obviously looking at some safety parameters. The baseline demographics, as one would expect, about 85% were females. Age group, although it was above 18 years, but as you could see, the majority of 83% were above 50 years of age, and more than 90% were residing at home. Once you look at the substantial reduction in urinary incontinence, you can see there's a substantial improvement in urinary incontinence episodes. And also at 12 weeks, about 88% patients reported improvement in the treatment benefit scale. What about the use of pad? What about decrease in pad usage? And again, 2 to 3-fold decrease was noticed, both in use of pad liners and diapers. And I think this is interesting, but this mirrors the randomized trials that a third of the patient in the real life report 100% reduction, and 2/3 report more than 50%, which kind of mirrors the randomized trials. What about the decrease in the frequency of need to urinate? And I just want to draw your attention to the last one, that I could not delay urination. I had to rush to the toilets. It was quite reduced substantially in a 12-week period. Looking at the adverse events, there were actually 3 serious adverse events which were not related to the Onabotulinumtoxin A, but the drug-related incidents were about 2.9%, and you can see majority of them were mild, which were cystitis or urinary tract infections. There was some bleeding, and one patient reported some kind of a weakness in paresthesia, which resolved spontaneously. So, Mr. Chairman, in summary, this actually is an interim analysis looking at Onabotulinumtoxin A, and it has shown significant reduction in urinary incontinence and urgency episodes. A significant proportion of patients, like in the pivotal trials, report more than 50% or 100% reduction in their urgency episodes. Improvements are similar to that in the randomized trials. And for cost implication, a number of patients report significant decrease in the incontinence products, and it was well tolerated. Thank you very much.
Yeah, this paper opens discussions.
Yes, excellent presentation. One question about the adverse event, which you didn't mention
On the serious adverse events, one was unknown, we didn't know, it was not reported. The other two, one had a myocardial infarction, and the other was admitted to hospital with unexplained illness, which was not thought to be related to Onabotulinumtoxin A. The one which complained of paresthesia was reported in the drug-related events.
Okay.
Other questions?
Question
here.
Yes, sir.
Very interesting talk. So do you think that the reason this toxin is working is because it's preventing signals going to the nerves, so that if it's not sensed that the bladder has, you have to urinate, then the people don't have to do it. So is it blocking the neural signaling to the brain, or spinal cord?
That's what we think and believe, because as you know, initially we thought it mainly acts on the motor part, but now increasing thinking is it is the sensory part where it is more effective, and hence the decrease in dose, and that is the reason that their frequency urgency goes down.
Have there been any mouse studies done on this to see whether there's signaling in the brain that's affected?
No, not really, no. Nobody is doing it, as far as I know, in a proper scientific fashion.
Okay. Terrific, thank you.
Well, thank you.
Thank you.
Thank you.